Welcome to This Week in Orthopedics. This week we're covering 7 notable papers spanning spine surgery, knee arthroplasty, arthroscopy, and sports medicine. Let's dive in. In the realm of spine surgery, 2 significant cohort studies evaluated reconstruction strategies and alignment goals. Writing in Spine, Jakob and colleagues conducted a retrospective cohort study of 4,412 patients in the United States to compare multilevel posterior cervical laminoplasty versus multilevel posterior cervical laminectomy and fusion. The authors found that laminoplasty was associated with roughly half the risk of operative adjacent segment disease and all-cause reoperation compared to laminectomy and fusion. Interestingly, laminectomy and fusion was selected at more than twice the rate of laminoplasty despite these higher reoperation risks. Complementing this cervical work, Mohanty and colleagues published a study in the Journal of Bone and Joint Surgery, evaluating the T4L1 hip axis in 427 patients undergoing long-segment posterior spinal fusion for adult spinal deformity. Using multivariable analysis, they demonstrated that deviation from a harmonious alignment, measured via the T4 pelvic angle and L1 pelvic angle mismatch, conferred a U-shaped mechanical complication risk, where both undercorrection and overcorrection increased the likelihood of implant-related failures and complications. Turning to arthroscopy, sports medicine, and ligamentous reconstruction, several studies explored surgical technique modifications. In arthroscopy, Gosnell and colleagues reviewed 139 patients who underwent meniscal allograft transplantation, comparing suture-only fixation to bone bridge and slot and bone plug techniques. Patients who underwent suture-only fixation experienced a significantly higher meniscus-specific reoperation rate of 31.3%, compared to just 8.9% for bone bridge and slot and 10.9% for bone plug fixation, with meniscectomy and meniscal repair representing the most common subsequent surgeries. In knee and patellofemoral disorders, Vincent and colleagues conducted a prospective single-center study in knee surgery, sports traumatology, arthroscopy examining 121 patients undergoing isolated medial patellofemoral ligament reconstruction for recurrent patellar dislocation. They compared patients with an increased tibial tubercle trochlear groove distance of 20 mm or greater against those with a normal distance, finding no significant differences in postoperative International Knee Documentation Committee scores, functional improvement, complication rates, or instability recurrence. This suggests that an increased tibial tubercle trochlear groove distance should not be used in isolation to mandate bony realignment when low-grade trochlear dysplasia and patella alta are absent. In hip preservation, 2 studies in the American Journal of Sports Medicine examined midterm outcomes at a minimum of 5 years. Kehna Rochkin and colleagues performed a propensity-matched study of 94 patients undergoing arthroscopic subspine decompression for femoroacetabular impingement, finding durable patient-reported outcome improvements and survivorship comparable to matched controls without subspine impingement. Meanwhile, Quesada Jimenez and colleagues compared labral reconstruction with labral repair in 68 matched patients undergoing revision hip arthroscopy. Both techniques yielded significant and comparable improvements in patient-reported outcomes, meeting minimal clinically important thresholds at similar rates with low complication profiles. In knee arthroplasty, Tay and colleagues investigated item-level longitudinal associations using registry data from New Zealand. Sports traumatology, arthroscopy. Analyzing 9,384 total knee arthroplasties and 2,424 unicompartmental knee arthroplasties across up to 15 years of follow-up, the authors identified that question 1 on the Oxford Knee Score, addressing overall pain, demonstrated the strongest and most consistent association with patient satisfaction, showing strong discriminatory performance that approached the full multi-item instrument. If you only have time for one paper this week, make it the cohort study by Jakob and colleagues in Spine comparing laminoplasty to laminectomy and fusion for multilevel posterior cervical pathology. It provides robust registry-level evidence that laminoplasty cuts the risk of reoperation and adjacent segment disease in half, challenging the predominant use of fusion in clinical practice. Here are the key takeaways from This Week in Orthopedics. Multilevel posterior cervical laminoplasty is associated with a substantially lower risk of reoperation and adjacent segment disease compared to laminectomy and fusion. In adult spinal deformity surgery, maintaining a harmonious T4L1 pelvic alignment is critical, as both under- and overcorrection increase mechanical complication risks. For meniscal allograft transplantation, suture-only fixation yields significantly higher reoperation rates than bone bridge and slot or bone plug techniques. In isolated medial patellofemoral ligament reconstruction, an increased tibial tubercle trolley groove distance does not compromise outcomes if severe trolley dysplasia and patella alta are absent. Finally, overall pain is the single most dominant driver of patient satisfaction following total and unicompartmental knee arthroplasty. That's your roundup for this week in orthopedics. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.